All right. Hi, everyone. Happy lunchtime. My name is Ollie Ben. I'm the Director of Philanthropy and Social Impact for the Jewish Community Foundation here in San Diego. Thanks for signing in for today's Access to Insight. There is just so much information to process right now, more than any one person can possibly filter. JCF's Access to Insight series is here to provide you with firsthand information and resources so that together we can make sense of what is happening around us. The Jewish Community Foundation believes that every individual has the power to make a difference and that together we can change the world. A significant part of that mission involves ensuring that our community is well informed with access to important decision makers and thought leaders. Our past Access to Insight sessions were about the public health response to the coronavirus and about financial planning, and those have been viewed many hundreds of times. In case you missed them, we've made recordings of those events available on JCF's website and also on our YouTube page. Today, we go from the big picture globally to zoom right in now to what's happening to our most vulnerable populations right here in San Diego. Before we begin, I just wanted to let you know that you can submit a question through the Q&A button at the bottom of the Zoom window, and our presenters will answer as many as they can as time allows. Also, at the end of the call, we'll be talking about the ways that JCF is helping the organizations that are focused on supporting the most vulnerable in our community and how you can help. So please stay tuned for that. Now, I'm just going to switch views so that you can see our speakers. We called this session "The Needs Are Extreme," and unfortunately, that is not hyperbole. We're going to hear from Greg, Anahid, and Paul about hunger, homelessness, and the needs of seniors, and just how much the coronavirus has exacerbated the situations in those already vulnerable areas. First, we'll hear from Anahid Brakke. Anahid is the Executive Director of the San Diego Hunger Coalition, which leads coordinated action to try to end hunger in San Diego County. Anahid previously served at the Leash Tag Foundation, right here at the Jewish Community Foundation, at the San Diego Foundation, and at the Gary and Mary West Foundation, all the foundations, before assuming leadership of the San Diego Hunger Coalition in 2015. Then we'll hear from Greg Anglea. Greg is the CEO of Interfaith Community Services, which empowers people in need to stabilize and improve their lives through comprehensive programs in partnership with diverse faith communities and people of compassion. And as you can see, Greg is going to be giving us a very interesting tour of his facility, which is why he's already all masked up. Greg previously worked at CSU San Marcos, the Joan B. Kroc Institute for Peace and Justice at USD, and he's been the CEO of Interfaith Community Services since 2014. Finally, we'll hear from Paul Downey. Paul is president and CEO of Serving Seniors, which helps seniors in poverty live healthy and fulfilling lives. Paul has been president and CEO since 1995. In addition to building and operating the 200-unit low-income Posika family senior housing complex in downtown San Diego and 150-unit affordable housing complex for seniors in City Heights, Paul has overseen the agency's wraparound wellness services, nutrition program, public relations, and advocacy efforts. In 2015, Paul was invited by President Obama to participate in the White House Conference on Aging. Just as a reminder, feel free to submit questions using the Q&A button in Zoom, and after our presentations, we'll take as many questions as we can. And now I will turn it over to Anahid, who will take it from here.
Thank you so much, Oli, and hello everyone, and thank you so much for joining us today and for your concern about food security here in San Diego County. I'm going to share my screen and talk a little bit about the Hunger Relief Network in general, kind of where we came from and where we are now. Okay, is that up? Great. So as Oli mentioned, our mission is to lead coordinated action, and we try to enable the hunger relief community to operate making data-driven decisions. About 4 years ago, we launched an effort called Hunger Free San Diego, that's very focused on trying to create a more interconnected safety net of food assistance resources, so that when a household has an occurrence where they lose income, or our economy takes a hit like it's taking right now, and so many people lose income, that we have systems in place to be able to connect people immediately to the food assistance that they need. I wanted to just briefly touch on, again, like our situation before COVID happened. So we did have, you know, more of a hidden crisis, a food insecurity crisis here in San Diego County, with one in seven people not always having enough to eat, and 1 in 5 kids. In San Diego County, across all 42 of our school districts, about half of our public school students are enrolled in free and reduced price meals. That means that over half of our local children live in households with 185% of federal poverty level as the household income, which is less than a household needs to make ends meet in San Diego County. Before the crisis, we already had a meal gap. And when we looked at the number of people who were in need of assistance, we looked at people who would respond to a survey and say that they did not have enough food or they ran out of food. We also looked at all the people who were currently accessing our food assistance systems. So that includes school meals and CalFresh and WIC, and the meals for older adults. And so we looked at all of the meals that were produced by our hunger relief system, all the different types of programs, looked at the total need, calculated how many meals that people generally need, and looked at how many were self-purchased. This is how many our food assistance network was producing in 2017, and we had a gap of about 70 million meals. So in this current situation, we are increasing the number of meals that we're producing through food assistance, but we're seeing a major hit to this section, the amount of meals that people are able to provide. So the demand on the Hunger Relief Network is bigger than it's ever been in San Diego County during our lifetimes. So looking at our food assistance network, the reason that I'm starting with this is I want people to understand the relative contributions of impact that come from different channels. And as funders, it's important that the philanthropy community and our hunger relief sector are thinking about diversifying our efforts and diversifying, especially where we're putting charitable investments, so that we can bring as much federal resources and as much federally funded meals into the community as possible. If we try to only promote and only support this private charitable piece of the pie, we're never going to be able to meet the need. So it's important that we do it, that we are dividing and conquering. So I'm gonna start with CalFresh, which is this biggest portion of the pie, and talk about some of the immediate opportunities within that program. So CalFresh is California's name for SNAP, or food stamps. I think it's important for us to, I want to take a quick, do a super quick analysis to just demonstrate the impact of what I'm saying about ROI to some extent. So right now, California has increased the allotment for people who are on CalFresh to the maximum allowed per household. So that means a family of 4 will get $646 a month if they're already enrolled, or if they're able to enroll by by the end of this month, they'll get the emergency allotment for May. $646 a month is about 200 meals. That's equal to 12 30-pound food boxes. I don't think I probably don't need to say much more about that. So with CalFresh, okay, so now I'm going to our website, and I encourage you to send people in the community to this site, or providers to this site, or looking for ways to refer people to available food assistance. We have pages on the different types of programs. I'm going to start with SNAP. So the #1 way that people can apply and get benefits quickly right now is through a website called getcalfresh.org. And that is basic. I'm looking for to see if there's a place here where you can see it. Here we go. getcalfresh.com. I think it's .org, getcalfresh.org. In any case, it is a 10-minute application. And so for households who have never had to apply for CalFresh right now, don't encourage them to call 211 at this moment. 211 is overloaded and they are pushing benefits and enrollment appointments out to May. So if people are tech savvy and have, or you don't even have to be too tech savvy, but if they have access to the internet, go on getcalfresh.org and apply through that, and that will be the easiest way to get CalFresh benefits immediately. The other thing is that effective April 28th, CalFresh recipients will be able to use their cards online for grocery delivery, ordering from Amazon and Walmart. So I think for people who are brand new to this type of food assistance, you know, it's accessible in ways that are maybe more familiar. I also want to mention that the county has streamlined its application processes here in San Diego County and actually the whole state. So interviews are not required. Telephonic signatures are okay. People don't have to go to a county office. In fact, they shouldn't go to a county office. The county offices are closed. However, for people who don't have a computer, don't know how to find information, there are stations outside the family resource centers. So the family resource centers are open with tables out front. But we do want to encourage people to apply online. Next, I'm going to talk about kids' meals. And so if we just flip back to the pie chart, you'll see that about 55 million meals a year come from free and reduced price meals for kids at the after school supper program and the summer program. So these are 3 meal programs that are for kids who are low income. This is not all the school meals that are provided, but at the same time as our need is skyrocketing, this huge chunk of the pie took a major hit with the school closures. Right now, I would estimate that about 10% of those meals are getting out to the community. And I think that might be my chat that says I need to wrap 2-minute warning. What is happening with the school districts is they're transitioning from cafeteria service of meals to curbside, grab and go. Cars are coming through. The staff of the food nutrition service departments are standing there handing out bags or putting it in their trunks. That information is available for open school sites on the San Diego County Office of Ed site. But again, if you tell people to go to our COVID-19 page, you can go to Meals for Kids. The government is changing the structures or changing the regulations constantly. So now they can do multiple meals in a day. They don't have to give out 20 little milk containers. They can give out a half gallon of milk. So we're really looking at the school districts as an opportunity to funnel more meals into our hunger relief system at the same time as we're continuing to support on the ground food pantries. And I'll let Paul will talk about senior meals. I just want to mention that WIC is still up and running. It's another very important federal nutrition program. If funders are looking for ways to help children 0 to 5, we have 6 WIC offices. They're all independent. And they need assistance because they're losing workers from COVID. And so they're also short-staffed at a time when people need the program the most. So I'll stop there and wait for questions later, but here are the WIC offices.
Great, thank you so much, Anahid. And as she said, you can submit questions through our chat function. Greg, I will turn it over to you.
Great, thanks, Oli. So I'm here in the lobby of Interfaith Community Services Escondido headquarters, the Betty and Melvin Cohn Center, and you can see it's empty. And you can see that we even have taped off chairs. The reason is most of the services that we're providing that we used to provide personally face-to-face are now being provided remotely and out in our parking lot. Oli, is my reception good? Can you hear me okay? All right, great. So Here is our computer lab. We are bringing people into our service center on a very select basis because we need to make sure that everybody is as healthy and as safe as possible. So I just stepped out of our lobby, which on a normal day like today would be full of people, because what we're doing here at Interfaith Community Services is meeting the basic needs of individuals and families. And we're providing grocery assistance, we're helping with access to shelter, we're doing deeper dives to help individuals apply for unemployment insurance. A lot of people have never done that before who are coming here in recent weeks. We're helping people to find new jobs. We work with employers. We get people into employment, and if they need housing, we get them into housing. All that's happening largely outdoors now as a result of this crisis. I'm going to show you a couple things. You may see me move a little bit because we have a lot of people around here, and I'm going to be very careful to respect their privacy and to not have anyone on camera who hasn't agreed to be a part of this fine webinar that we have here today. So I want to show you what our food pantry looks like. So this morning, our food pantry here was filling to-go bags. We've been filling bags from our nearby warehouse and created kind of a core set of food that we're providing individuals. Our volunteers, and we're on lunch break right now, so it's a quieter time. Our volunteers augment with custom food for the size of a family, with bread and with fresh produce outside. The reason that we have this system in place is because we are now seeing a 4 times increase in the amount of families coming here in need of food assistance. On a typical day, we would see anywhere between 40 and sometimes even 50 families a day come for our services. On one day last week, we provided food assistance for more than 600 men, women, and children at this location alone. I'm going to show you how we have the setup here. What we've done is we've set up a drive-up food delivery system. Behind me, we have numbered parking spaces, and every morning and every afternoon, people can drive up from the community. They're greeted by one of our staff at our front gate, and we find out, what are you here for? Are you here for food assistance? If so, go on over to space number 7. Are you here for taxes? Because we're still completing tax returns for low-income individuals and families. If you're here for taxes, pull up into the taxes space. Are you here to drop off a donation? We need that as well. You can take a space right over here. And our staff then come up and meet with people at their car and find out what's going on. Last week, we had a young mom who was in our food space just over here. She had never been here before, and she was scared. And she kept apologizing over and over and over again. I'm so sorry, I'm so sorry. And we said, no, you're okay. This is why we're here. This is what we're here to do. We helped her with food. We helped her with hygiene items and diapers for her kids. What we also do is connect people to deeper dive services. So if somebody comes here and they've had a reduction in work hours, which is the most common need we're seeing right now, we're gonna find out if they've applied for unemployment insurance. If they have, that's great. If not, we'll help them find out how to do that. And if they need to do that online, they can do it remotely. We've installed special extenders for our Wi-Fi system to cover the outdoor area here. So we'll help them get applied for unemployment insurance if that's the case. We have a lot of people who have already lost employment. I mentioned earlier, we'll help find job opportunities. We're going to provide the basic stuff that people need to work in those jobs. Obviously, you got to have face coverings. All of our staff, all of our clients, the 500 plus people we're providing shelter to on any given night, they all need these. We need them donated, but we're also providing them to people so they can go out and they can work. And then we're doing deeper dive services to help people to be able to stay housed who are on the edge. We had a 71-year-old lady come in here, this exact parking lot last week. She has asthma and she works part-time, collects Social Security insurance. She was no longer able to work as COVID began. She feared She was scared to even come here and certainly did not want to get out of her car. We helped her with food assistance, and then we helped her get rental assistance. We provided the rent directly to her landlord, worked with her, dropped off the paperwork at home. She wasn't tech savvy and couldn't figure out how to do it on the computer, so we went and met her at her home after she had been here earlier in the week and helped her to be able to stay housed in her home. Interfaith Community Services last year ended and prevented homelessness over an 18-month period for more than 2,000 people. So we have the mechanisms in place to do this work, and it's what we're doing in an even greater way here in response to this issue. I want to show you another thing, and then I know we're precious on time here. We have a co-located health center. So everyone who comes into our center gets screened by temperature and for medical condition. Behind me is a COVID testing tent. We're testing people on site if they become symptomatic. And then we're also operating, hey Kim, we're also operating our Haven House shelter, which used to be a night shelter, 24/7. I'm gonna be careful not to get anyone on camera, but I'm gonna show you here. This is Hussein behind me. Hello, Hussein, our shelter supervisor. You can see the bunks behind me. You see some empty bunks that don't have bedding because we've reduced the density of our shelter to provide for social distancing. The rest of the shelter is behind me there. And then I'm gonna point at the ceiling for a second. My apologies. Again, all working on privacy here. Sorry about that. And then immediately next door to us is a large motel that we have 80 rooms. We're providing additional shelter for individuals who are homeless and either due to age or health condition are recommended to shelter in place during this crisis. So we have selected 80 of the most vulnerable households to be literally right next door. It's the motel is that brown wall right there. And then we also have an additional motel in Carlsbad that we're doing the same thing. So that's a quick rundown. There's so much more to say, but I want to give you a sense of what we're doing here on the front lines and the amount of people, the hundreds, and frankly, the thousands of people that we're serving. We're doing the amount of work in 1 week that we used to do in more than a month. So it's a lot, and appreciate everyone's support and time today.
Thank you, Greg, so much. That was incredible. Thank you. Paul, let's turn it over to you to talk about seniors. You need to unmute yourself.
All right, well, great. Well, thanks. Good afternoon, everybody. I'm delighted to share a little bit what we're doing at Serving Seniors. But before I do that, I want to kind of set the stage of what's happening with older adults in San Diego. So 2 out of 5 older adults in San Diego County do not have enough money for the basics. So we're talking about food, shelter, housing, transportation. And this comes from the Elder Economic Security Initiative, or Elder Index, that's prepared by UCLA Center for Health Policy Research. So they look at a county by county to determine what the needs are. And so they've determined that in a place like San Diego, a senior needs about $24,000 a year in order to meet the basic needs. So about 41% of San Diego seniors didn't meet that threshold, shall we say, January or February before COVID-19 reared its head. So there was already significant need on a daily basis. At Serving Seniors, our typical client lives below the federal poverty level. About 85% of them live below the federal poverty level, which is just over $1,000 a month. So about 50% of the elder index of what they actually need is about $1,000, and 85% of our clients live below that. So you can see there is considerable need and demand for services. We see a significant number of homeless seniors. In fact, about 1/3 of the homeless on the streets of San Diego are now older adults, 55 plus. So it's a growing cohort and a cause for concern with the lack of affordable housing that we have in San Diego. So at Serving Seniors, we provide an array of safety net services aimed at keeping people healthy and independent. So that includes meals. So at the end of February, early March, we were serving about 2,600 meals a day. About 2/3 were in one of our 11 senior centers, and about 1/3 were home delivered. And I'll come back to this in a second to talk about where we are now. But meals were core. Housing services. We run over 450 units of permanent supportive housing that we own and operate. We provide homeless transitional services for the older adults that I was mentioning. We provide case management services. We provide mental health, healthcare, access to healthcare, through our collaborative partners, access to dental healthcare. So a whole array of services aimed at keeping people healthy and independent. So when along comes early March, in fact, March 12th specifically, the County of San Diego came in and shut down all of our senior centers. We had been operating up to that point on very strict conditions where we were screening everybody coming in, doing a lot of extra cleaning to keep people safe and healthy. But March 12th, they shut everything down. And we had to literally transition overnight from serving 2/3 of our 2,600 meals through congregate to transitioning to folks receiving those meals delivered through our home delivered meals program. So we were successful. We transitioned most of those folks. We did some to-go meals at our congregate sites. And I should mention our congregate sites range all the way from Oceanside to San Ysidro, as far east as Lakeside, Lemon Grove, La Mesa, Ramona, City Heights, and of course our flagship facility, the Gary and Mary West Senior Wellness Center, downtown San Diego. So we're all over the county. We had a transition. And so on March 12th, we were doing just over 800 meals on a daily basis. As of today, we sent out 6,000 home delivered meals. So more than a six-fold increase in the number of home delivered meals and more than doubling the total number of meals that we're serving. And frankly, that isn't enough. The demand is increasing as people are getting more hunger, anxiety, and concern about whether they're going to get food. So we are working right now to ramp up what we call our shelf-stable meals. And these are meals that don't need to be heated or refrigerated, that people can store. And we are going to ramp up and anticipate serving another 6,000 meals a day through shelf-stable. And the reason we have transitioned to the shelf-stable is that, frankly, our kitchen is at capacity at 6,000 for the regular meals that we are providing. So by early May, mid-May, we hope to double again to about 11,000, 12,000 meals on a daily basis to feed hungry seniors. So that remains our core, but we're also focused on health and well-being related to the COVID-19 situation. So we're currently working with West Health and UCSD on a telehealth project where we will be able to screen people that in our housing complexes, some of our home delivered meals clients, as well as the to-go meals that we continue to serve out of the Gary Mary West Senior Wellness Center, primarily to homeless seniors. We're doing about 350 on a daily basis. So we're going to do a telehealth so that we can screen, and if people are showing COVID-19 symptoms, we will be able in real time to connect them with an ER doc to get advice as to about what we're doing. Our clients are most at risk being older adults. Most of them have multiple chronic health conditions, so we're very concerned about their health and safety. And before I wrap up, I want to just also talk about social isolation. Many of our folks were isolated before this occurred. They live alone, mostly in some of the single room occupancy hotel rooms, which are maybe 100 square feet, shared bathroom down the hall situations. But more and more now, folks who were active and involved in the community are now housebound. They're unable to see friends, family, grandchildren. A lot of their social activity was structured around going to the bank or the hairdresser or the grocery store or the senior center. And so what I want to suggest to you is if you're not already doing it, look out for your neighbors. Look out for your older adult neighbors. Check in on them, call them, knock on their door, keep social distancing, but just make sure that they're getting some socialization, but making sure that if they need help getting their medications or toiletries or anything else, that you're reaching out to do that. So I think with that, I'll stop and look forward to answering some questions.
Great. Thank you so much, Paul. Some good questions have come in, and feel free to keep sending them in. The first one is a two-parter, and I think maybe, Greg, this one, you can take a first stab at this one. Obviously, there's a large financial need, but in addition to philanthropy, what are your other needs? And how do people, the second part of that question is, how do people balance the sort of stay-at-home social isolating mandate with the need for volunteerism? How do they stay healthy, but also...
It's a great question. So obviously we're an essential service. The services we provide are essential: food, shelter, housing, and we're helping people to stay fed, to stay healthy, and to be able to lead their lives. So our staff do this work because they've made careers out of it. They're putting themselves in harm's way to help others. It's what we do. It's why it's why we're in this career, is to help others. And we have volunteers who do the same thing. And so when it comes to volunteers who are still doing this work, it's a personal choice up to them. We obviously are very careful and safe in the way that we're operating now, creating and providing social distancing, having proper PPE. But it is a challenge, and it is certainly still a risk. We are providing hazard pay to our staff to support them in this time. But it's still a real challenge. And we've relied upon donations to do this work. So out of the non-monetary side, we need donated PPE, masks, gloves, hand sanitizer urgently. We need it urgently. And we also rely upon volunteers to do this work. And everything that I've just described is all listed on our website, interfaithservices.org. There's a COVID-19 page you can click on, and there's some information that we've provided to JCF to be able to share as well.
Great, thank you very much. Next question, which is another good one. Obviously, we're in a very acute phase of the crisis right now, but this is in some way or another that we don't really understand going to be going on for a while. So can you speak, and frankly, any of you can answer this, can you speak to how you anticipate the longer term needs playing out, and what challenges are going to be on the horizon?
Sure, well, maybe I can take a first stab at it. I haven't been through anything like this before exactly, but I've been around for 25 years at Serving Seniors, so I've seen things like the 9/11 and the financial crisis of 08. And I think it's going to be the lingering impact on organizations like the three of ours. Right now, there's a lot of attention. We're in a crisis mode, and people are being extraordinarily generous and stepping up. I think the concern for all of our populations, as you heard, that we're working with, there was great need before COVID-19, and that need doesn't go away. We haven't stopped the challenges there. And so those needs are going to continue, and they're going to be exacerbated by the residual impact of this virus and the impact it's had on our society. So, and especially as we're going to likely be in certainly a recession, absolutely, for a year or 2 years, and possibly even an economic depression. So the need for support for organizations like the three of ours and the many other great organizations is going to continue and probably increase as we move 6 months, a year and a half. And so I think the challenge will be being able to sustain and maintain this interest in what we're doing as we go forward, because once we get back to whatever normal will look like in the future, the needs are still going to be there that we're dealing with every day.
One thing I think that will help a lot and help organizations like Interfaith and Serving Seniors is if philanthropy keeps in mind how we can leverage these federal nutrition programs. They were already underutilized in San Diego County, which means that we were paying taxes for food that wasn't coming to San Diego County. And I think that we have a very generous philanthropic sector, especially when it comes to hunger relief. And so we're kind of like limping along with the system that we had, and maybe not investing enough in trying to make those programs work for the people that they're meant to. But if we're going to make this through the long haul, then we need to assist people in signing up for SNAP, CalFresh. We need to look at how to get the school meal programs running in a way that works for the new world of how schools are operating. Some specific examples would be providing, not only providing funds for some of these immediate needs for interfaith and serving seniors, but also give them some funding for application assistance for the people they're seeing, so that the people that are in need can piece together multiple types of assistance. And that's really going to be the only way that we can make it through the next 18 months or so that people are going to be suffering.
Yeah, and I would just quickly say that this crisis does not treat all people equally. It's harming the most marginalized and disenfranchised of our society many times. Moreover, people without childcare, people with both parents in the household working, individuals working in the service industry, individuals who are continuing to work in essential services, or grocery clerks, who are paid very little, and it just is highlighting the pretty inhumane way that we lead our society and treat a lot of the people who make our society possible. And so my hope is that we will see this as an opportunity to make true systemic changes that are needed to provide a more just and equitable way for all people to live, and to heal and repair a world that is broken. And this is highlighting the ways that it is broken. And we'll do that with basic needs, and we'll also do that systemically by advocating for bigger changes.
Thank you, Greg.
I am so sorry. One more thing, just that a way that people on the call can help is that to help spread the word that anyone can go to a school to get meals. Anyone with children can go to a school. It doesn't have to be the school that your child already attends if that school is not putting out meals. And school meals are not public charge. And so that is a really important message for our immigrant, undocumented, and mixed status households. That is food assistance that they don't have to worry about getting.
Thank you. Anahid, could you speak a little more about the change? I know you mentioned this already a little bit, but can you just speak a bit more about the issues facing children both in schools and out of schools?
In terms of access to meals?
Yes.
Well, I mean, when we have 42 school districts. In some of our districts, as many as 80% of the children who receive free and reduced price meals, 80% of them rely on that lunch every day. So at the same time that their parents are losing income, they're losing this incredible support that they've relied on to be able to make ends meet. The schools are, if you go to the San Diego County Office of Ed website, that's where people can see the schools that are serving meals. It's a tremendous stress on the families, especially the families who have kids at home and are trying to balance everything. I will say that the government is changing things constantly. Like right now, what sites can do is they can pull together two different programs. The summer program, actually all the schools are using the summer food service program right now, or the summer seamless option it's called for districts. They can do the after school supper program and the summer meal program and give out 3 good meals and a snack every day. Or they can go to just distributing like a few times a week and give multiple numbers of meals. And the after school supper program is also just is now allowing food for over the weekends. So we're working on more and more opportunities and trying to get the word out as we learn about them.
Thank you. We have a question that I imagine Greg and Anahid can take. Just further about volunteering. One person has written and said they understand the San Diego Food Bank is no longer taking volunteers. Are you aware of other organizations that need volunteers?
Yes, I know one. Yeah, at Interfaith Community Services, we have an urgent need for volunteers. Interfaithservices.org. You can see all of our volunteer opportunities there. We have volunteers working in our food pantry behind me, morning and afternoon, Monday through Friday. We also have a congregate meal service. We used to have a lot of people who would come in to our nutrition center in the morning. That's now a to-go meal service. And so we need volunteers to put together meals that we can serve to go. We also have virtual opportunities to help people with the resumes, help people look for work, all on our website, interfaithservices.org.
Thank you.
One of the things that I think we're seeing is that the volunteer coordination is a little bit disjointed, but we do have some different sites that are rising to the challenge. So we've got Hands on San Diego is starting to post COVID opportunities. There's another site called justserve.org. A little harder to navigate, but they are also posting opportunities. Similar to serving seniors and interfaith community services, the smaller pantries also need personal protective equipment. If people want to make masks, we still have shortages of masks. And I think the social media, like especially some of the smaller organizations that are run by volunteers, never had social media, or the school districts, the smaller districts could use help with those types of things as well.
Thank you. Do you want to add something, Paul?
No, I would just encourage people to, if they want to volunteer, to do it. I mean, we are fortunate right now. We actually are kind of like the food bank that we have a lot of folks have stepped up, which we're really grateful for. But there's a lot of organizations out there, like Greg's that still need help, and would encourage people to reach out. And things are a little discombobulated right now for a lot of organizations, so they don't immediately get a call back. Call again or check again, just because people are running in a lot of different directions. Yeah,
this may not be an easy time to volunteer, but if you are interested in volunteering, you should show determination. I'm going to roll two questions that are unrelated into one, just because in the interest of time. And Greg and Paul probably will want to take the first part of this, and all three of you can take the second part of it. So maybe if you each take a turn to answer in sequence. The first part is, what alternatives are available for emergency and affordable housing, and how are they accessed? And the second part, which again is unrelated, but just in the interest of time, I'll give you each the mic, is what are some positives you are seeing? Because there's a lot of bad information, a lot of negative information flow right now, and sad stories we're hearing, but what are some positives you're seeing? So I'll just start with Greg.
Yeah, and I can answer both together. We are looking at motel and hotel conversions to create more affordable housing. One of the reasons that there's a large amount of individuals without housing in our community is if somebody only has Social Security or disability insurance, it's very difficult to find any place to live on that income alone. There are, in North County in particular, really no what's called single room occupancy units, the kind of entry-level housing that for a long time was the baseline for somebody with just that to be able to have a place to stay. So silver lining is that we're managing 120 hotel rooms right now with 120 very vulnerable, mostly older individuals who have been homeless for many, many years, now stabilized and beginning to get medical treatment, beginning to connect with disability benefits access, beginning to talk about addiction treatment for some who have that, not everyone, but some do, and beginning to look at housing. So that's an amazing solve for some very disabled and challenged individuals during this time of crisis. And tomorrow, through a group we have in North County called the Alliance for Regional Solutions, we'll be bringing together all of the North County mayors and our North County supervisors to talk about a regional plan around homelessness amidst the COVID shelter crisis, whether that's more hotels for short-term shelter, also hopefully including purchasing blighted motels to turn them into housing. We could see some real positives come out of a very challenging situation.
Thank you.
So do we have another 3 hours to talk about affordable housing? Because from my perspective, I mean, absent this immediate crisis, the biggest impact on older adults in San Diego, and frankly throughout the state, is the lack of affordable housing. whether it's at the entry level, as Greg was just talking about, but even lower middle income seniors are having trouble finding places that they can afford to live. So that is a major challenge for us. We develop housing, we build housing. It is a complicated process. Right now in San Diego, waiting list for affordable housing in ours, it can be 6 to 7 years. We just opened a new housing complex in Ramona, the Schmale Family Senior Residence. 62 units, over 3,000 applicants for those 62 units. So we need a focused long-term strategy to develop more housing. I think purchasing hotel rooms, Mayor Faulkner in the city of San Diego has talked about doing that, but we need to create more units quickly, and we need to streamline the development process to build more units. And from the positives is that we are seeing, as we talk to a lot of the seniors that we're delivering to, I was encouraging people to reach out to their neighbors, that I think people remember the lessons from watching Mr. Rogers maybe about taking care of our neighbors, is I think there is a sense of maybe I should know who my neighbor is, I should reach out, I should take care of them. And the other positive is just the dedication of our frontline staff. I mean, we've got people who are coming out, going in and delivering 140 meals a day, going into SROs and senior apartments, and putting themselves at some risk, and just their willingness to raise their hand and say, yes, I will go do it, and do it with pride.
Thank you. And Anahid, do you want to bring us home with a positive?
Collaboration in the nonprofit sector. I still hear people say that nonprofits need to collaborate more, but what I see is collaboration countywide. I see a very intricate ecosystem of collaborative networks that know each other and work together. I see a very sophisticated nonprofit sector who understands what it's doing, who has been looking at systems change, who has been understanding, working with other leaders to understand the landscape. And I think we're in the best possible position as a nonprofit sector with robust partnerships on the government side and on the for-profit side. And I think, as we chatted about, people are really seeing how fragmented the safety net is right now because more people are falling into it. I think we're going to emerge from this with a stronger safety net and more of an appreciation of the fact that there's very little difference between us as human beings, and it's really more about income and circumstances at the moment that make the differences.
Great. Thank you so much. Thank you, Anahid, Greg, and Paul. 1 second. Thank you for that amazing information. We really appreciate it. You all, to all the people who've dialed in, you'll be all getting an email very shortly with some additional information from our speakers. There'll also be a link to the recording of this webinar, which we will hope to have up by tomorrow morning, so you can share that with others if you feel compelled to do so. We'll also be asking you to complete a 4-question survey to help us create more compelling content like this that's relevant for you going forward. So if you wouldn't mind taking the time to answer that question, or that 4-question survey, we'd be really grateful. Now, the Jewish Community Foundation has set up 3 COVID-19 emergency funds to tackle different important aspects of the pandemic relief. One of those funds is called the Vulnerable Local Populations Funds, and is specifically targeting organizations like the ones Paul, Greg, and Anahid represent. The email we're about to send will contain details about that. Our next Access to Insight session is going to be a really interesting session. We've been talking about COVID-19 as a health crisis, really focusing on the physical effects of the crisis. But now there's increasing discussion and awareness, as some of our speakers talked about today, about the psychological impact of this crisis, and the fact that that may actually have a societal effect that outlasts the actual virus. We're going to bring you speakers who can talk both about this in terms of the personal, which will be very useful to each of us, as well as the macro societal views of the view of the implications of the mental health challenges. So we'll stay tuned for more information about that session, which is coming up next week. Also, we wanted to let you know that our CEO, Beth Cyril, will be presenting at the Jewish Impact Investing Summit being virtually hosted by JLens. The Impact Investing Summit is May the 18th and 19th and will now be 100% free and online. So you should listen to Beth and the other great speakers at the Jewish Impact Investing Summit. All of this information I've just mentioned will be sent to you via email. If you have any questions, you can email me at ollie@jcfsandiego.org or mara@jcfsandiego.org. So thank you so much to our speakers, Greg Anglea from Interfaith Community Services, Anahid Brakke from San Diego Hunger Coalition, and Paul Downey from Serving Seniors. We will see you all again next week for the Jewish Community Foundation's next installment of Access to Insight. Thank you.